Well, without further ado, I want to get to tonight's guest, the CEO of Fruit Street, Laurence Girard. This is actually a fascinating interview because we're going to talk business and also health. And what could be wrong with that? So, Laurence, thank you for joining me here on Mind Your Business.
Thanks for having me.
This is special. So, you're a young guy. You're a CEO. Tell me a little bit about your background.
Well, I'm 25 years old. I'm the CEO and co-founder of Fruit Street. Grew up in Huntington on Long Island. And I was always interested in science when I was younger because I grew up a few minutes away from Cold Spring Harbor Labs where they did all the early DNA research. So I would go to their summer courses, learn basic
How
lab
young
techniques.
were you when you did that?
I was probably 7th or 8th grade.
Oh, man.
But then in high school, I was very naive and I deviated from science for a little while and wanted to play professional soccer. And so I ended up playing for the youth team of the New York Red Bulls during my senior year of high school. And that's how I got interested in diet and exercise, which eventually became more of a public health interest when I decided to focus on something with more of a social impact and go to medical school. And so that was my early life.
Very interesting. Now, I see here in your bio, you went to Harvard. Tell us about it. And then first tell us about that. And then my next question, the obvious question is, so you went to Harvard and now you're the CEO. What perhaps is a single takeaway you could say that, you know what, I learned this in college and this I was able to execute in my responsibilities as an executive?
Yeah, so the year after I graduated from high school, I had decided I wanted to go to medical school. And so I was volunteering in my local emergency room at Huntington Hospital in the North Shore LIJ system, spent about 700 hours working in the emergency room. But it was a very unique experience because simultaneously I took 3 online courses through the Harvard Extension School. And the first course I took was in nutrition epidemiology with the Harvard School of Public Health professor. And so I realized by doing those two things at the same time that a lot of the patients we see coming into the emergency room with heart disease, diabetes, stroke, obesity, and other conditions, that we really could have prevented a lot of those conditions through the right diet and lifestyle intervention. But then the following year, I moved to Boston, and I was in the bachelor's degree program at the Harvard Extension School for 2 years, taking mostly government, public health, and psychology courses. I took a venture capital course and a computer science course on wearable devices, and had some professors who were physicians at the Institute of Lifestyle Medicine at Harvard Medical School, where they teach clinicians how to do these lifestyle modification programs with their patients. But it was also during my first year of college that Harvard opened the Harvard Innovation Lab on the Harvard Business School campus, where they have serial entrepreneurs come in and teach and mentor the students. And that was really where I learned about entrepreneurship. And ultimately just realized that I wasn't necessarily interested in becoming a physician, but I was interested in public health and how do we use technology to impact these lifestyle-related diseases. And so, during my second year of college, Fruit Street had started as a summer project, and some physicians invested in it, and I actually had a previous startup before Fruit Street. But, a few years later, now we're doing this full-time and making a very big social impact. And I think the one takeaway would be that I guess I learned through the Harvard Innovation Lab that entrepreneurship can be a tool to scale scientific research and ultimately have a big social impact. It's great if we have all of this science, but you need business people to scale the science so that it impacts more people's lives.
Let's get into the meat and potatoes. What is Fruit Street? Tell us about what it's all about.
So Fruit Street is a public benefit corporation whose mission is to prevent and treat lifestyle-related disease using telemedicine, so virtual video visits with your healthcare providers, wearable devices like Fitbit, and our mobile application, which allows patients to take pictures of their food and get feedback from a dietitian. But what we specifically focus on is delivering the CDC's diabetes prevention program, which is a 1-year-long diet and lifestyle intervention designed to help pre-diabetic patients lose 5 to 7% of their weight through diet and lifestyle changes. And it goes back to clinical research at Massachusetts General Hospital. And then the YMCA got a big CMS innovation grant where they enrolled 3,000 participants into a research study. And they wanted to see if the drug metformin was more effective than the lifestyle intervention in preventing diabetes. And they found that actually by making simple diet and lifestyle changes, it was more effective than taking a drug. And it reduced the risk for developing diabetes by about 58%. And the actual program at the YMCA was 22 one-hour-long group classes where a trained lifestyle coach would run these classes covering topics like cooking, sleep, stress management, exercise, diet. And what we're doing is taking that in-person program and making it more convenient for people by doing group video conferencing calls with a registered dietitian. They get a free Fitbit and a wireless bathroom scale as part of the program, and they can take pictures of their food in the mobile app. And so instead of having to drive 30 minutes to a medical clinic or a YMCA, they can do this from their mobile phone. They can do this from their home, and it's just much more convenient for people.
Now, I mean, there are many in the listeners of this show who are hearing about this for the first time. How else do people hear about this, and how could they find out more information?
Well, some of the commercial health plans and insurance companies pay for this for their members, and these health plans will reach out to their members to inform them that this is offered to you as a benefit. It doesn't cost any money. Physicians are becoming more aware of prediabetes as well, which is basically elevated blood glucose levels, but it's not quite yet type 2 diabetes. And so physicians are starting to refer into the program that Fruit Street is delivering as well. Sometimes an employer might also speak to their employees about this and offer it as a corporate wellness benefit. So you basically have physicians, employers, and health plans that are making people aware of the program.
I love the honor of interviewing C-level executives and sharing their great advice and perspective on Mind Your Business. I'd love to get your feedback. Post it in the comments below and subscribe. You'll never miss an edition of Mind Your Business.